Okay, maybe what we'll do then is we'll go over to Cora, and then there's going to be a little bit of time for questions at the end, and people can also email questions in if they don't feel comfortable speaking about them in front of the whole group. So Cora Taylor is a licensed clinical psychologist and researcher, as we heard, at the Autism and Developmental Institute as part of the Geisinger Health System. And I have to say, she's just absolutely fabulous. She completed her doctorate at the University of Tennessee and did a postdoctoral fellowship at Vanderbilt University. She works and has experience evaluating children from birth through childhood with a range of neurodevelopmental disabilities, and she provides behavioral-based treatment to children and adolescents with autism spectrum disorder and other neurodevelopmental disorders. We've had the pleasure of getting to know Cora and seeing what just tremendous work she does, and I'm really, really thrilled to be able to have her here with us tonight to be able to address what I know is a very real concern about some of these behavioral challenges. So I'll turn it over to you, Cora. And do I need to do something to hand this back to Cora? Lindsay, can you just take this away?
She should have it now.
I think I have it. Thank you very much. So I will move forward to my first slide. And thank you so much for letting me talk today to all of you. And I appreciate everyone who sent in questions to me in advance. And just to give you an idea kind of about some of those questions, really, it seems like a lot of you are dealing with some really significant and challenging behaviors and trying to understand how to deal with those, not just in general, but also in the context of some of the other concerns that you have for your child, like the medical concerns that Dr. Chung was just talking about, as well as language deficits and some cognitive deficits, as well as symptoms of autism spectrum disorder. And this purpose of this presentation today, since it's just a brief time, I just wanted to give a broad overview of how we think about behaviors and how we try to influence changing those behaviors, and to give you an introduction to some strategies that we have seen to be effective in other children who have neurodevelopmental disabilities. So just to get started, I just want to put this question out there and this thought out there. So really, what is a behavior problem? A lot of times we talk about children who have behaviors, and I want to just mention that behaviors are not all bad and they're not all challenging, and to try to think about behavior really broadly and not just about what are the things that we don't like that we want to change, but also think about what are the behaviors that we want to encourage or we want to develop in our kids. So I've just listed an example of some behaviors that we might see in children. So for example, using a gesture or a picture or a word in order to communicate with us is a behavior. Putting a dish in the sink, or sharing a snack, or grabbing your hand so they can cross the street as a safety. Those are all good behaviors, but we also see with the good behaviors seeing some of those challenging behaviors, like falling on the floor and crying or having a tantrum, taking or grabbing a toy away from someone instead of asking to take it, or protesting by throwing objects or pushing objects away that we don't want. So behaviors really do come in both varieties. We have the ones that we want to encourage. We also have those ones that are really difficult to deal with and we want to try to minimize as much as possible. So to start out, so how do we think about behavior? How do psychologists or behavior analysts think about behavior when we want to change behavior? And I'm going to talk a little bit later specifically about functional behavior analysis, which is something that sometimes a lot of parents hear about when they talk to psychologists about behavior change, but this is a little bit of an intro to it. So we think about it in what we call the ABCs. And the A stands for the antecedent. So what happens before the behavior? And this can be something that you actually do, but it could be where you are or what is going on at the time that the challenging behavior occurs. And then B is specifically what happens, what is the challenge. And then at C, the consequences, we're thinking about what happens after the behavior. What did we do to respond to that behavior? And by looking at all of these three things, it helps us understand why behavior happens. And a lot of times with children, we're really focused on the consequences of behavior. So we want to change, what do we do after? So we give a punishment or we give a reward. But for many children, especially those with neurodevelopmental disabilities, we need to think about both the before and the after. So we want to think about what can we do to help set our children up to be successful, and then how can we respond in a way that encourages the behaviors we want to see and minimizes the behaviors that we don't want to see. So, and let's just start thinking about the before, since that's the piece that sometimes we don't think about as much as the after behavior. So what can we do before a behavior happens? So the first thing that we can do is try as much as we can to pay attention to good behavior. And that can be really difficult sometimes, especially if you have a child who maybe has a lot of challenging behaviors. As we spend so much time thinking about and talking about challenging behaviors and the bad behaviors that we don't want, that we almost can sometimes have no energy left to think about, well, what are the good behaviors, or what do we want to see? So trying to, as much as we can, shift the focus and trying to pay attention and hone our eyes into when the behavior is going positive, the behavior is good, and recognizing and trying to give good praise or a good reward for when that behavior just happens naturally, and letting the child know very specifically what about their behavior was good, why was that a good behavior, and trying to give it lots of good positive attention for engaging in that. And then again, this is just as I was mentioning earlier, we want to prepare for success. So what can we do, especially if we know we're going into a challenging situation? What can we change to make good behavior more likely to occur? So what can we do to kind of stack the deck in our favor and in the favor of our child to help them be more successful even in challenging situations? And then making sure that we have a good response. And once a challenging behavior is established, we can change consequences, but often the best thing that we can do is making sure that we are changing the consequences and changing what happens before so we can help the child actually succeed. So preparing for success. So the first thing to do is to really be clear about what the rules are and what your expectations are for behavior. And the first step to that is getting everyone on the same page. So this includes caregivers, babysitters, teachers, anyone that the child is working with. We want to make sure that we are being as consistent as possible across everyone. And this can be a challenging thing to do, but it's a very important first step because behavior change can be hard. And so the best way to start going about it is making sure that everybody is on your team, that we're all on the same page with what are we going to do when this behavior happens. And I also want to encourage you that it's okay to pick battles, especially if you have a child right now who has a lot of challenging behaviors. You might want to think about sitting down as a team with other people who care for your child and trying to identify what are the most important behaviors for us right now. And just thinking about what are the top 2 or 3 behaviors that we want to work on and really focus on those. Because if we try to change everything that's going on with the child all the time, that can be exhausting, and we'll end up, like I said before, focusing more on what's going wrong all the time, and that can take a lot of energy. So we want to try to focus our efforts, and part of that is getting everyone on the same page. And also recognizing that sometimes with behavior, things might get worse before they get better, and you should keep going and remind yourself, really, keep going. And I'll talk a little bit more kind of about why sometimes things get worse before they get better, but it does happen. It actually can be an encouraging sign that you're doing the right thing. And then, and part of that too, making sure that we're teaching as well. So we want behavior to change. We want it to change into something positive. And so in order to help facilitate that, we need to be teaching the child what the appropriate behavior is instead. So a lot of times you'll hear that heard as called a replacement behavior. So giving them something else they should be doing in place of that. And if we skip that step, sometimes it might turn that they to replace their challenging behavior with a different challenging behavior. So we want to make sure we're not just addressing the challenges, but trying to teach and encourage skills at the same time. And then preparing even more. So what else can we be doing? So one, having reinforcers ready. So reinforcers can be different for every child, but what are those things that motivate your child or make them happy, make them realize that they did a good job? So for some, and that can be different for every child. For some children, it is heavy, heavy praise and clapping and yays. For other children, that can be overwhelming. They prefer a pat on the back or a sticker or a special time with a parent or a special trip or activity. And that can, what reinforcer you use to can depend on where your child is developmentally right now as well. So for children who are younger, we want to try to give more immediate rewards so they know right away what the behavior was. That we want to encourage. Other children might be able to wait or to learn that they're earning a more long-term goal. Also, trying to manage your emotions as best you can. Like I mentioned earlier, behavior change is hard. And when we decide to do it, we have to really be prepared. So one thing I suggest sometimes for parents is that when we teach new behaviors or when we deal with challenging behaviors, it doesn't always have to be in the context where the behavior usually occurs. If you have the opportunity to try to practice the behavior. So a lot of times families talk to me about having trouble doing things like going to the grocery store or going out in public is so difficult. So trying to find a time where you can actually just practice going to the grocery store. Maybe you don't actually even need anything, but so if you have to leave and things didn't go well, it's not a big deal. You didn't need whatever it was you were going to get from the store. We're just going to go for the purpose of practicing going out in public together. And being prepared to respond to inappropriate behavior, making sure everyone on the team knows exactly what we're going to do. And then setting up the environment to help the child know exactly what is expected from them. So overall, just to summarize some of the things, so big effective strategies, one is clear and effective communication, both within your team and to the child as much as possible on their level. Providing as much structure, routine, and consistency as you can. So trying to make everything predictable the same way. Making sure you're paying attention to any signs of anxiety in your child or recognizing any specific triggers that they might have that might precede some of these challenging behaviors. Making sure you're paying attention to their language skills and how their development might be influencing their ability to understand what you're asking of them. Using redirection and distraction can be very effective, especially in pinch moments like when we're out at the grocery store or we're about to have a tantrum. So having some of those tools at your disposal. Using schedules and visual supports, I'm going to talk at length a bit about some visual supports, and those are often really essential in being able to structure the environment appropriately. So I'll start with physical structure, and I like this picture because sometimes we talk to kids in language that can be a little bit abstract. And what physical structure and what visuals do for kids is they help clarify expectations. So when we say something like, keep your hands to yourself, what does that mean? It doesn't really mean anything. It's very abstract concept. Keep them to yourself. So I have just a picture here of an example of how we've added in a visual structure or a visual boundary to help communicate what we mean when we say that. Because it doesn't necessarily always mean keep your hands right in your lap. You could be keeping your hands to yourself while you're drawing on the table. Or we talk about keeping our feet to ourselves. What does that mean? They don't always have to be crisscross applesauce. They could be right out in front and still be to ourselves. But this just gives us something really clear and very structured that can help a child understand what we mean when we give a directive. Visual schedules also are just a very powerful tool to help clarify expectations. They help children understand what's coming next. A lot of times our kids have trouble transitioning from task to task. So this sets a clear expectation about what is going to happen and in what order. And for some of our kids too, who have trouble coming off of preferred tasks, it helps communicate to them when that preferred task is going to be available again. So when we ask them to stop playing with a favorite toy, it doesn't mean that we're taking it away for the rest of the day. It's likely that they're allowed to have that back, and we're able to call their attention to when they're going to be able to access other things that they might like later in the day. Visual schedules are really appropriate and can be modified for a variety of ages and developmental levels. So at the younger end or at lower developmental levels, we can use visual schedules to be actual objects. So for example, we might have an actual diaper for a diaper change time, and then an actual pencil or crayon for scribbling or coloring time. And what that lets us do is that as the child picks up the item, they already have what they need to engage in the task. And so the item itself is the prompt for what they're supposed to be doing right now. As children get a little bit older, we can use pictures. This is probably the one that you see the most commonly. So little line drawings of what the child is supposed to be doing, sometimes accompanied with words if the child is learning to read. And then again, as they get older, we can transition that to just being words for our kids who are reading. And a lot of times parents talk about, being concerned that visuals are going to be a crutch for children in the long run, and they might not be developmentally appropriate over time. And I'm just going to skip forward a slide and show you, these are my visual schedules that I use every day. And they're more complex than the visual schedules that we give to our kids. It includes a calendar view and an agenda and a to-do list, but these are all visual schedules. And so the really powerful thing about visual schedules is that as our children age, their visual schedule can age with them in a very appropriate way. So we can use that as just a great, powerful tool. And then going back one slide, we can also use visual schedules to help break down complicated tasks. So once a child learns to use a schedule, we can use it for so many things. It doesn't just have to be how your day is going to go, but it can also be what are the steps to brush teeth. Again, it clarifies expectations and it decreases that need on having to engage our working memory and remember everything that we're supposed to be doing during a teeth brushing task. We can just reference the schedule to make sure that everything is complete. And again, we can do this through pictures, but we can also do it through objects. I've had parents use Barbie dolls in the shower, and so you can disconnect Barbie dolls' joints from each other, and whenever the child was done washing one body part, they could put it in a done bucket. So they would know exactly all the body parts that they needed to wash using the Barbie doll. So we can also use visuals for non-preferred tasks. So when a child is engaging in something that they would not like to do, but we're going to give them a reward after, we can use first then boards. So on the left side, we would have the task that they are going to do, followed by a picture of what we are going to do next. So it's really just a visual representation of saying, if you finish your work, then we can have ice cream, or whatever the reward might be for finishing work. Timers can also be a powerful tool. So showing exactly what when what I don't want is going to be over. We can also use it for when good things are going to be over, but I prefer to some extent to use it for when things I don't want are going to end. And it helps clarify, just like that idea of keep your hands to yourself, it helps clarify abstract concepts like not now or later or soon. Those don't necessarily mean very much. When is not now? Is it now? Is it now? We can break that into a lot of minute parts. So it helps children to understand when exactly that thing that they want is coming. And on the next slide, I have an example of a choice schedule. So, and this is kind of a fusion between the visual schedule and a choice board, wherein we have a mix here of two non-preferred tasks, going to the bathroom, and then a number of preferred tasks. And this is what the checklist is. This is what we're going to go through today. So they're able to see the ratio there. We're going to do a lot more things that we like than things that we don't like, And we can have some flexibility and pick which order we want to do these things in. But here's what we're going to do today. And also thinking about how can we change our language to help set our children up for success. So focusing on giving choices, but making sure we're limiting the options. So sometimes just by changing our language from what do you want to wear today, which could be a very broad choice, and maybe all of the options of what they might want to wear today might not be available. From do you want to wear the red shirt or the blue shirt? So we're simplifying it, but still allowing them to have some level of choice. We can also do that even with non-preferred tasks. So do you want to take a bath or brush your teeth first? So sometimes that takes the emphasis away from do I want to do that task to which one am I going to do first? Also trying to limit the attention to saying no to things and focusing on what is available. Sometimes with kids, they can get really focused on the idea that we told them no, rather than there are other things that they may want to do and they'd be okay with doing, and instead just really focusing on the fact that we told them no. Okay, so that's a lot of information about before the behavior. And so now I want to shift my focus a little bit and talk about what should we do after the behavior. So there's really a couple of ways to address it. So one, we have reinforcers. So those are things that we would give for behavior that we wanted to see. So for some kids, it might be stickers, it might be a preferred activity or access to a certain toy, and it could for some kids be as simple as praise and attention. And then we also have consequences. So some of the typical consequences we think about is a timeout from things that we want. It could be just having to correct the activity. Sometimes we have overcorrection, which is when a child does something wrong, they have to do more to make up for it. So a typical example would be if a child throws something on the floor, they have to pick up everything that's on the floor. So doing even more than making up for just their simple action. We do have to remember, and I know I mentioned this earlier, that reinforcers and consequences are very individualized. And what might be rewarding for one child might not work for another, and vice versa. Something might be punishing for one child but work for another. For example, time out might be punishing for some children, but for some children who are trying to get away from something that they don't want to do, timeout might actually have been rewarding that behavior because they got to escape somewhere that they didn't want to be, or something that they did not want to do, or sometimes escape from a non-preferred person. After the behavior, it's important as well to minimize the attention to the behavior as possible if it's a challenging behavior that you don't want to see. This can be very difficult, especially for any type of aggression or biting or hitting to self or to others. So what I would encourage you to do is try to frame in your mind, what's the least amount of attention possible that I can pay to this without allowing the child to get in any harm? So we talk a little bit about blocking behaviors, so trying to put yourself in the way where the child is unable to engage in the aggressive behavior if that's not a danger to you. And I would try to talk as minimally as possible to the child, so saying as few words as you can in that moment that you can manage to get away with, just to try to reel it in. So if you find yourself, when the child finds himself trying to talk a lot, trying to reason with them, I would try to take a step back and really reel in your words and bring yourself down a notch as much as you can and minimize the attention to it. Also, for many children, we find that sometimes more talking can make the behavior worse. If all the child heard was no, trying to reason with them can just escalate a tantrum. So again, I would encourage you to try to take a step back and just minimize your reaction as much as you can. Okay, so I do want to finish up today by talking about functional behavior analysis. So this is something, like I said earlier, that many psychologists will talk about, or behavior analysts will talk about, wanting to do a functional behavior analysis. And the purpose of it is to understand why a behavior is occurring. And often that can be the first step for us changing that behavior. So even when we don't realize it or don't understand it, and even if a child can't answer, why did you do that? There is usually a purpose or a function for the behaviors. And for many children, not being able to answer why they engaged in a behavior is very developmentally appropriate, and that might not be something that they're able to do. So FBAs are usually conducted through data collection, and this is something even that you could do if you see a recurrent challenging behavior. So you would write down exactly what the behavior was, and then write down what was happening just before. So those are those antecedents that we were talking about earlier. What was happening right at the time of the challenging behavior? So write down, where were we? Who was there? What were we doing? What did I say to the child? What did someone else say to the child? What time of day was it? Are all good questions, are all good things to be asking yourself for that antecedent part. And then the second part is, what happened just after that behavior occurred? So what were the consequences for that behavior? Did we move the child to timeout? Did we provide some distraction? What did we do, or what happened right after that behavior occurred? So in talking about antecedents, we start with, so what happened before the behavior? So some common things that occur before a challenging behavior, we can talk about telling a child no is very common. Asking to participate in a non-preferred task, so asking them to do a piece of work that they don't like doing, or sometimes putting any demand on a child at all can be an antecedent for a challenging behavior. Sometimes sensory sensitivities, or having to be in an environment that the child doesn't like or makes them very uncomfortable, can be a part of that. But there's also hunger can be something. So is this something that's happening right before lunchtime, or is this behavior happening before the child even has breakfast? Could there be pain associated with that, or is it sleepiness? Is it occurring around the time where we would expect that child to be going down for a nap? So these are all things that can really precede some of our challenging behaviors or make those challenging behaviors more prevalent. And then our consequences are what happens right after the behavior. And really, when we think about the consequences, what we want to look at is, did the child gain access to something that they wanted as a result of that behavior, or did they avoid something that they didn't want because of that behavior? And that's where we really get at that function. Why is this behavior continuing to happen? So now that we have an FBA, now that we've done all of this and we've looked at the setting events, what might be happening before the behavior, and we've looked at what might be happening after the behavior, we need to make a plan. So what are we going to do? So first, we have prevention strategies. So what can we do? What can we change about the before to make that behavior less likely from happening? And then we also have to look at the after. What are we going to do to react? So sometimes we need to change our reaction to that behavior if we're going to help it get better. And trying to do both of these is important. So what we were talking about earlier with the visual schedules and the antecedents and preparing for success, those are our prevention strategies. But then also having a plan for what's going to happen when the behavior does occur, or if it does occur. The piece that's really missing from this slide, as I realize, is that we also have to provide some instruction. So if we can prevent and we can react, but we also need to teach the child what they can be doing instead. So it's important to note here, too, that the function of the behavior isn't necessarily what's wrong. So it's okay for a child to want attention. It's okay for a child to want to gain access to something that they like. And it's okay for the child to want to get away from something that they don't like or take a break from something that they don't like. What's wrong is how they're going about it. So if they're going about it by swiping things off the table or by hitting, it's the behavior that's wrong. It's not what they want that's wrong. So first, if we have behaviors used to gain attention or to gain activity. So what can we do before? So first, providing clear schedules about when the child can gain attention from adults or when the child can gain an activity, and making sure the child gets enough breaks as is developmentally appropriate. In terms of reaction, we want to try to block as many of the disruptive behaviors as we can and minimize our attention to them, but then also make sure we teach a child the appropriate way to request and make sure that we reward that consistently. In terms of behaviors used to avoid, this can be very difficult. So one, our prevention strategies, adding structure. So using our task visual schedules, breaking it down into smaller parts so that it's not as big of a task. It's a number of small tasks. Using visual schedules and timers and visual reward systems. So as they engage in a number of behaviors they don't want, they can see that they're working for something that they do want. It's important to remember here in terms of your reaction that if you place a demand, you must follow through. So if you're specifically working on a child to complete a certain task, you have to be willing to stick with it, because as soon as the child is allowed to escape from that, they've just learned that if they do it for long enough, they will escape from that thing that they don't want. So you have to have it in your mind to be very persistent. And to some extent, this can even be done with hand over hand for some kids and ending on that, going along with the behavior just as best you can. It can also be lowering the demand a little bit. So if they're clearly not going to be able to engage in the original request, it's okay to lower the demand to try to end on the actual engagement. And then in terms of our teaching strategies, we want to teach strategies for a child to request breaks in an appropriate way. And then also on your side, be able to recognize when a break might be needed. So if they're getting restless, then asking them, okay, let's just do one more, and then we can take a break, and showing them how they can do that more appropriately. So in terms of what strategies should we use? So we want to learn a new skill. We might need to teach an appropriate or an acceptable replacement behavior. A lot of times we need to increase behavior like following directions, or decrease behavior, running out of the room. As much as you can, try to honor the function of the behavior. Just like I said earlier, the function of the behavior is not the problem. It's the challenging behavior that's the problem. So how can we teach a strategy that honors the function? But sometimes we have to recognize too, we can't honor the function of the behavior. So sometimes if a child wants to remain in the room during the fire drill, we can't honor the function of that behavior. They have to leave the room during the fire drill. They have to engage in that. So we also have, those can be very challenging when we have to actually deny the child the function and try to put in some really strong reinforcement, the strongest ones that we have, to help them engage in the behavior. So sometimes challenging behaviors can become a pattern, and sometimes it can feel like things are just going wrong every time, and every time you try to change it, the same thing happens, and it gets very, very frustrating. So it's important to remember that challenging behaviors are a pattern, and they can be difficult to change. If it's become to the point where you're almost in a routine of a challenging behavior, where you have a behavior that happens every day in the same way every time, I would encourage you as much as you can to try to break the routine. So if you have a situation that goes bad every day, try to bring in an outside person, somebody who can look at it with fresh eyes with you, or somebody who can walk through that behavior.
Cora, it sounds like we might have lost your audio feed. Can you hear us? Wendy,
Hello?
can you hear Cora? Oh, hi, is that Cora?
I can't hear. I can hear you,
Actually,
Jennifer, but I can't hear Cora.
You know what? I see her still on the list. Okay. While we figure out what happened with Cora's audio, do we want to go ahead and move to some additional questions, Wendy?
I can, you know what?
Hello, it's Cora. I'm sorry, my phone just dropped off the call.
Oh, okay, great. We're glad you're back.
Okay.
Keep going.
I apologize. I'm back. So
that's okay.
I'm not sure exactly where I dropped off, but I was talking a little bit about challenging behaviors that are really ingrained and have become a routine almost to have this exact same challenging behavior on a daily basis. So I would try to break the routine up as much as possible. So whenever that challenging part of your day is, try to bring in an outside person. Would a relative or your behavior analyst or a babysitter be willing to try that routine with the child to see if they might be more successful as an outside person? Try to change the time of day that you engage in that behavior, that you ask the child to engage in that task. So if you do it in the evening, let's try to move it to the morning. Let's try it in the middle of the day. So we're really changing the skit. We're changing the script that we have in our head about this is how this interaction is going to go. We're trying to change little pieces of it. Change the structure. However we do it now, we're going to do it somewhere else. We're going to do it in a different room. How can we change little pieces of it? And make sure to build in good rewards to try to make that time of day that's really hard much more rewarding at the end. Also, trying to make sure you give it enough time. So when we start behavior change, sometimes it can take 2 to 3 weeks to really feel like we're starting to make a real change. So when you decide to stick to a new method or try a new strategy with a child, give it at least 2 to 3 weeks before you give up on it and say this doesn't work. And remember, as I said earlier, behavior might get worse before it gets better, and this is normal. So the real life example I like to think about is a soda machine. So every soda machine that I've been to, for the most part, when I walk up to it, I put in $1, I press a button, and I get my soda. It works every time. And then one day I go up to my soda machine, I put my $1 in, and I push the button, and nothing comes out. This is something I've done, and it's worked every time, and I've gotten what I wanted, but this time it didn't work. And typically what people do is they don't just walk away and decide, oh, well. What you do is you push the button again. You might push it harder and try harder. Some people have even, I've seen, kick soda machines when their soda didn't come out that first time. And that's kind of what's happening with behavior change, especially with these really challenging behaviors that have been going on a long time. Your child knows that that behavior usually works. And so instead of giving up on that strategy, sometimes what kids will do first is try harder before they change and try a different strategy. So again, that's a sign the strategy is probably working and to keep going. The major challenges that that pop up too are addressing behaviors that are automatically reinforced. So behaviors that might be rewarding to the child just for engaging in them. Developing programs for children who have difficulty learning from consequences can be hard. That's when we really have to focus on those setting up for success strategies. Making sure that we are trying to address inappropriate behaviors that are used to request or to protest. So those are things that we actually want to teach. We want to teach children to request appropriately and teach them to protest appropriately. And finding appropriate reinforcers can often be very difficult. And trying to come up with a variety as well, because if we use the same reinforcer every time, the child might get tired of that specific reinforcer. So trying to have a variety, and many of them, can be something that's hard. Okay, so that comes to the end of mine. There's a couple extra slides here. And so this was one of the questions that we received. And Wendy, did you want me to talk about this? I'm happy to go ahead and address it.
Maybe I'll just say a couple things here if it's okay, and then I'll let you go to questions. Is that okay, Cora?
Absolutely.
Okay.
Yes, that's fine.
Okay. So one of the things that I wanted to emphasize is that, the things that you've been hearing about, at least from me earlier tonight, were based on very small numbers. And in terms of being able to advocate for yourselves, for your children, I want to give you some of the tips that we've thought about and that we've learned from experiences with other rare genetic conditions. So one of the things is I think you're your own best advocates. And I just want to put out a shout out to Narissa because I think she's done a fabulous job in a couple ways of being able to put herself, her son, Kieran, out there and to be able to increase awareness. And I'm not saying everyone has to do what Narissa did, but I do think it's been something that in a good way has brought the spotlight onto HIV-EP2, and I hope we can continue the momentum in terms of being able to build upon some of the things that she's done. So one of the things is to be able to connect with researchers and then to be able to connect with other families and to be able to educate the community of providers teachers, educators, therapists, everyone in terms of HIV EP2 in particular. And Lindsay, maybe you can advance the slides for me. Great. Okay, so in terms of doing that, one of the things we do on Simon's VIP is to be able to make information like the information you shared with us freely available to the entire research community, and we hope that it's going to do a couple things. We hope it's going to catalyze the community of researchers to suddenly become really interested in HIV EP2 and start working to get grant support and doing experiments and figuring out how to treat this and making animal models and doing all of these things. And so we do this at Simon's VIP very specifically to be able to make the barrier to entry for researchers as low as it possibly can be, and just to also realize that for you as families, we completely protect your privacy so that no one knows who you are as we're doing this. And we also give you the opportunity to be able to do research studies or to be able to take it or leave it. So you'll see sometimes coming out in newsletters and things like that. We'll tell you what people might want you and your family to participate in, and it's up to you to decide whether or not that's the right study for you. As you're talking amongst other people in the HIV EP2 community, these opportunities might come up for you to basically to be ambassadors, to be able to explain some of the things that are going on, or even if it's not in the HIV EP2 community, for other neurogenetic conditions. And so as you're doing this, we just wanted to give you a few things that I think about, and all of us think about, I think, when we talk to families about this. Number one is that, we want you to be critical of us as researchers. We want to make sure that as you hear about opportunities for research, you think critically about, is it worth my time? Is it something I believe in? Is it something that I think is going to make a meaningful difference? Is it something I care about? But it should be all about you and your children and your families. And we want to be able to do the type of research that's going to be impactful ultimately to do that. So do think about that. And obviously, if you are energized and excited about something, that's going to show when you start talking with other families about this. As we start doing these, not everything in terms of research opportunities, and certainly if we get to the point of thinking about treatments at some point or interventions, there might be, pros and cons to particular treatments. And so you need to think about those. You need to think critically. You need to ask anyone who's asking you to do something, is there any danger? Is there any risk? And don't be afraid that if you don't understand it the first time someone tells you about it or the first time you read about it, ask questions. We're here to be able to answer those things for you, and to be able to be very clear and transparent about what the ask is. How much time is it going to take? How much energy are you going to have to travel? All of those things to be able to do that. When you're doing this, as I said, as you're encouraging other families, the thing that matters most is if you've done something, for you to be able to say, yeah, I did that, and here's what was good about it, here's what was more challenging about it. But your own personal perspective goes a long, long way to be able to make other families trust that it's something that's valuable and something that's not going to be scary. Next slide, Lindsay. Is there another slide in there? Okay. So as you're doing this, and I don't think I'll go through all of these necessarily, but you do want to ask in terms of making sure that your privacy is being protected, making sure that you're feeling comfortable about exactly what's being done and what's being asked of you. And one of the things I wanted to emphasize within all of this is that certainly, at least in terms of what we're doing with Simon's VIP, we're trying to minimize any of the pain that your children or you might feel, and maximize the upside from any donations you might have. And I specifically want to highlight biospecimens. So in other words, blood samples. At some point, if someone ever asks you to make a cell line, for instance, from blood samples, these are all things that we're doing centrally so that hopefully your one contribution can be essentially multiplied and given to many, many different researchers who might want to come in. You may hear at some point that researchers, for instance, want to take some of the cells from your child and be able to make what they call induced pluripotential stem cells, or be able to make neurons even out of blood cells, believe it or not, and make what looks like what they call organoids, or little sort of mini brains outside the body, but in a dish, to be able to understand better what HIV-EP2 is doing differently for your child and in your child's brain. So there are all sorts of things that researchers are thinking about doing, and we're trying to make it, as I said, as painless to you. So rather than having a dozen different researchers come to you, you can give a good donation one time and be able to enable and empower many, many different researchers to do this, and hopefully to be able to make big strides and big advances in terms of what they're doing. And then also, as I said, rather than for you having to fill out the same questionnaires over and over again, by you doing it just once, we can make it, again, stripped of all the information about who you are, but make it broadly available to many, many folks, many researchers, that is. Next slide.